Why do men actually go to a sex therapist? Is it porn addiction, performance anxiety, or when the morning glory suddenly disappears? In this first part of our conversation with sex therapist Sarah, we uncover the struggles men rarely talk about, but that affect confidence, intimacy, and relationships every single day, from porn addiction to erectile dysfunctions. This is the stuff that usually stays hidden. Not today. Stick around, because understanding these issues might be the first step towards a healthier sex life and a stronger and more intimate relationship. Let's grow.
Cheers, man.
Cheers.
What are we doing?
We are preparing the director's cut for our newest episode with Sarah.
Which is? It's a sex doctor.
It's a sex talk.
It's a sex talk.
We're talking about sex. Now I want this song, you know? Let's talk about sex, baby.
Okay, it will be coming in here. Because Kevin has massive porn problems.
No, but we're very much looking forward. We know that in general this is a topic not many people, and especially men, don't talk about. So I'm really excited to what Sarah will tell us.
Do you have a cringe feeling now going there, or you're like completely...
No, I'm actually super curious. I don't have a cringe feeling at all.
Because we are not the patients, but...
Yes, true. We don't have yet the issues, but I'm super interested. And also what are patients that she usually sees, what their main topics are. And it's not that I don't see like performance issues and anxieties. I very much can relate to that.
5 years ago probably I would be super cringe, but now learning, maybe also prevention, you know.
Prevention. Yeah.
What do you think is the biggest issue for men that they go to Sarah?
Porn addiction.
Be also my guess.
And thereby like erection problems.
Is that linked? Like you,
Yeah.
I think you said something about it, right?
I mean that's the main issue behind it. I think performance anxiety.
Okay.
Yeah, coming too early, too late.
Too late. I mean, I think if I would take a guess, there's like a huge percentage that is addicted to porn, even if they don't know it.
What's up?
One add-on, what I thought is a main reason. Probably also when there's like you're in a long-term relationship, right? And then harder to keep up that excitement from the beginning.
Cannot relate.
Because never had a long-term relationship. Well, what were you saying there? Like, what was the quote? We will put it in there.
For some people, sex is becoming like a service that needs to happen now and then, every Sunday after a TV show called Tatort.
We have to be quiet.
Super cool. Thank you very much, Sarah, for having us here today. Welcome. And everybody, and especially us, is of course interested. What's your background? What are you doing, and how did you get here?
So my background is, I wasn't very straight, but I studied psychology. I never wanted to go into clinical psychology in the first place, but I was always interested in sex therapy, couples therapy. I guess for me it was normal part of life that it's important to talk about sexuality with your partner. When I grew up, at some point I realized that other people don't, like for them it's not as usual or as normal to talk about it to their partner. I had the feeling they had issues sometimes, they were struggling, and I was always wondering why, because I noticed, okay, apparently I'm not struggling that much with it, and I just got interested, read a lot of studies. So my background is I'm a psychologist, I have a systemic coaching education, then I did training on sexuality, Sexualberatung. I'm a systemic sex therapist, and I work as a sex therapist and couples therapist, basically.
The systemic part in it, actually, what does it mean? I mean, sexual therapy, I can imagine what this is about, also psychology, with the systemic.
There are different approaches towards therapy in general, and usually in Germany you know of 4, which is psychoanalysis, which is basically most of your subconsciousness. It's what we know from Sigmund Freud. It's a way of how you treat patients, basically. Deep psychology, which also goes into more of like, okay, what are the causes of something? And then there is cognitive behavioral analysis, which, we look at your behavior and then we try to alter it and look how is the behavior influencing other things. And then there's systemic. So what systemic is trying to do is trying to look, it's more, we say like solution oriented. It doesn't say that we are here and we have the solution for you, right? But we look at where are you now, where do you want to go, and then how do you get there? So instead of focusing on the problem, we focus on, okay, where is it actually good? What kind of circumstances do you need in order for it to be good? Or we ask, okay, we always think there's a good reason for something. So for example, erectile dysfunctions, right? For me, that's a good thing. Or vaginism, it's a good thing because it's basically your body telling you something. We just got to learn what it is. Is your body telling you, hey, you're actually torturing me with how you treat me? Stop, I actually want to be treated with some caress, with, you know, some kindness. Or it's, hey, you actually, someone's, for example, who's in a relationship and already knows, I actually don't want to be in this relationship. Body's saying, hey, I'm afraid that we're going to have a child, but I'm actually not ready yet. I don't want this.
And how did you end up now focusing on these, like couple therapy and like sexual therapy for men? Is that right?
Exactly. So I do couples therapy and sex therapy. I do sex therapy also for women, but my main focus, men, mostly younger men. I also have elder men, but I have a lot of porn addiction, erectile dysfunction, premature ejaculation.
Now we're already going into the topics. So now what would you say are the main topics why people or like men approach you?
Coping with a breakup. So just being over a breakup and noticing I'm depressed and I can't get out of it. I don't know how to help myself. Erectile dysfunctions, premature ejaculation, porn addiction, like these are like some main things for men.
We just asked 2 women on the street whether their guesses are what are the main issues why men approach sexual therapists, and they said erectile dysfunctions and premature ejaculation.
Yeah,
so
right.
they nailed it.
Yeah.
So do you think that sexual education in general is getting more awareness now or more focus?
I think it should. I mean, also that was one of the main motivations why I started. Sexuality changed, sex education changed with the internet, right? So now the first approach with sexuality is mostly through the internet, or not mostly, it is for sure. And back in the old days, it wasn't like this. They're confronted with a different type of sexuality, and a colleague of mine always says he can see that the world is becoming more sexualized in a way. We're more confronted with a lot of sexual images or in general performance pressure, these kind of things. But the actual knowledge about sexuality is decreasing. What it actually takes, what it needs, intimacy, you know, these kind of things, but also how to treat your own body. These things are lacking. Like I support internet, all of this kind of education because, but on the other hand, there's a lot of risk and parents are not aware of it. And especially teenagers, they don't know what they're getting themselves into. And we can see that the prefrontal cortex, which is basically responsible for logical thinking, all of these things, is not fully developed. It plays a big role in regards to addiction. And the sooner you start, the higher is the risk that you get an addiction.
Why is it not fully developed?
Because it just takes time. The brain takes time to develop. Mm-hmm. So I think even until, I'm not 100% sure, but I think until you're 25.
Or did we already use social media when we were 25?
But pornography?
Oh yeah, pornography.
Pornography does something. And it's basically dopamine that's released, right? So with children, I don't teach them, hey, don't drink alcohol, but I do say to them, hey, there's a risk of getting addicted. You got to find out, it's a matter of how much you consume, what you consume. Do you consume hard alcohol or like softer alcohol? How much you drink? How often, right? Do you do that every day or once a week? With alcohol, we teach our children these kind of rules, right? We tell them, okay, don't drink every day, don't drink like very hard, not too much, and so on. So they learn how to calculate their risk for addiction. Yeah. But with pornography, nobody does that. But it's the same. You also got to control how much, how often, what kind. You know, do I watch hardcore porn or soft porn? There's a difference.
How much is too much? Because as you said, I think like porn gets treated more softly than, let's say, heroin or I don't know, or alcohol.
Yeah.
But it can get an addiction, and I think when are you addicted? I think there's like some statistics that say if you drink every day 1 beer, you're already somehow an alcoholic, which I don't know. But like, what is too much in terms of porn? Is there something you can?
So everyone is different, right? Also with alcohol, we have different levels that we can. But there's, in general, one rule. Do you have the feeling that the behavior is controlling you, or are you controlling the behavior, right? And if that switches, if you feel like you don't have control over it anymore, then there's certainly an addiction. But also, so when you feel like you can't stop, right? It runs all through the night for hours, or you can see that it impacts your life. Afterwards, you're going into a low and you have bad feelings. It's a very slow progress. With every drug, you know, it's a slow, you don't notice that you're getting into this, but we can see that people that consume a drug over a longer period of time, also pornography, the amount of dopamine receptors is reduced in the brain. So, and the less dopamine receptors we have, the less we are available, like we're able to enjoy life, like the simple things of life, right? And the more depressed we get. So often people come also with a depression and then realize, okay, there's actually a porn addiction.
Would you say porn addiction is rather a male topic, or from your experience you cannot really distinguish that?
So there are also females who are addicted to porn, but in general, as far from what I understand right now, there are more men, because it's more men interact with porn, but I think it's going to shift with the time.
Do you have any hypothesis why that is?
In general, men watch more porn. It's more socialized, right? It's more accepted, but this is changing. That's why I say it's like changing.
But you said also the type of porn is interesting, like it's important.
I think you can get addicted to everything. You can get addicted to like reading, because it depends on the amount of dopamine that is released. The faster it is released and the more that is released, the higher is the risk of getting addicted. Of course, when seeing it visually, usually it's a lot faster, right? Than via hearing, because what they do in fantasy, they build up a story, you know, it takes some more time. But of course, if you listen to it and then you always jump, then you can also, you know, speed it up. Yeah. So it's a matter of how you use it, I would say. So I see from a lot of clients that I have with porn addiction, at some point, I don't tell them they need to stop watching pornography at all. I give them the option to have like a moderate use. It's up to them. But many decide for complete abstinence because it's easier to maintain, because it takes a lot of willpower to do this moderate approach. But a moderate approach that they choose sometimes is, for example, going back to paper book, like to reading stories or just looking at magazines.
What are the negative effects of watching porn? So why should they actually get off this kind of addiction?
I'm not saying that pornography in general is bad, right? Sometimes pornography can be good. It can recreate the lust, you know, bring up some good things that have been gone for a long time maybe, you know? But yeah, I would say like with every drug, it's a matter of how much, how often. So the negative effects of it can be that it's also, when you use porn, how do you masturbate, right? Do you use... Most of the people, they sit or some stand or lay down on the ground. You have a very mechanic movement, it's true, right? So it's lots of pressure. Your body is under a lot of tension. Your breath is short and fast, right? So you train your body, you condition it to a specific stimuli. But then when you go into couples sex, this is not really working anymore. So you condition your body to something that is not made more or less of couple sex. So what I know, so the first things I see is often that, for example, and then they say, oh, when having sex, I really need doggy style. So because that way they can kind of reproduce this tension in the body and the firmness and the fast movement, which, you know, is not good for everyone, but this is like one way of saying, okay, I need this in order to have an orgasm. And they lose the fact of, you know, finding ways to do it differently. Or it's really depression. They start to get have to watch more and more extreme pornography. So pornography gets harder and harder, having difficulties in partner sex at some point.
How do what of kind of difficulties are we talking about?
Erectile dysfunctions, for sure. This is already a later stage, and this, you can't really make up the reasons. There can be different reasons because of they're ashamed, they're anxious, that it won't, last. Different things, but erectile dysfunctions I see often with porn use.
Now, maybe also circling back, why do you focus on sexual therapy for men?
There's a lot for women out there. I'm not saying that this is bad, I think this is great, right? But there's a lot of, especially online education for women and so on. But for men, I feel like they have been neglected for a longer time in terms of sexuality. It's like, oh, it's okay, they don't know how to talk about their feelings that well, and it's just accepted more or less. And we can see that, especially in sexuality, they cope with it. Like, for example, when you have a lot of stress, they use sexuality to cope with it. Or when they don't feel desired, they use sexuality to cope with it. Or lots of things, they feel like they're not the right partner, the right parent, and then they need the sexuality in order to feel that again, even though there are different ways to get that. But yeah, I think that sexuality is often used to cope with specific emotions, feelings. I find that sometimes more interesting in men because there's like a lot to get out of.
Yeah, there's more to.
But I think
to work with. Yeah, I mean, I totally agree. We do the same, no? Like that's why we're also focusing on holistic health for men, because we think many of these things have been neglected in teaching us or showing us. Sure. And that's why there's more to get out. And we all profit from, no? Like, that's the thing, you focus on men, but I think many women can profit from that if men know how sex actually works, like what's the do's and don'ts.
For sure, But I also see that, so I think because there has been a lot more focus on women, like the clitoris, and I think that's good, right? I feel like that many men that I heard with also colleagues of mine, they focus sometimes more on women. And then I heard from a lot of men, when they come to me, they're like, yeah, I've been to a colleague of yours, a male colleague, but I didn't feel understood. And I think being a woman actually can be an advantage because, first of all, I'm super curious, right? I don't have a penis, I don't know, right? So I ask a lot of questions. I really want to understand. Then the second thing is, of course, when you identify yourself as a man, right? There's often a lot of performance pressure, especially when you're with other men in the room. So when I don't see erectile dysfunction as a weakness. I see it as something strong, right? Your body's trying to tell you something. You just got to learn what. They often, when they come, they see it as a weakness, and then they talk to a male person basically, and they're ashamed. They're even more ashamed of admitting that because it would give them like a lower status in their view, I think. So it's easier sometimes for them to talk to a woman because I'm not there,
Totally makes sense. I think that's a powerful sentence, and I never thought about it like that erectile dysfunctions, or maybe also other dysfunction, I don't know, are actually a strength because they tell you something and then you can work with it. I think I never thought about it like in this way, but it's true.
It's a systemic view. It makes a lot of sense.
But you have to have the capacity to listen to it.
For sure. That takes some training.
With this listening to it, okay, what does it take men to actually approach you and like come to visit a sexual therapist? How much does it take? Like, I think none of my friends, or like I don't know anybody, maybe they also don't talk about it, but I would say I have open friends. I don't know anybody who went to a sexual therapist where I'm thinking maybe we should all go. So why is that?
I think so too. I think it would make a lot of sense to go like also in prevention,
Yeah, exactly.
Just learning the tools. I actually the other day I had a client, and the client said, Miss Alt, at the end, I learned so much about why didn't anybody tell me ever, right? I think everybody should go and see you and just learn the basics, more or less. I think, we don't talk about it in that level. So if we've never been taught, how are we going to tell others?
So how do they actually then approach you? Is it difficult to get?
How they approach me? So I think, unfortunately, mostly when they hit rock bottom.
That's it, no? When the pain is really...
When the pain is real.
Chuck, then you go.
Yeah.
Okay.
When the pain is real. Because, of course, different reasons. Either because the partner says, I can't do this anymore, or they themselves figure out, hey, I don't know, I feel like I have a problem, like I can't focus on work, I can't.
But what do I learn here so that I feel then healthier?
So you learn, for example, how to, even if you don't have a partner, how to feel fulfilled and happy, right? Because society often, for example, they suggest that people who are in relationship, that they are a lot happier and that they have to be, I don't know, or that you learn how to treat your body basically with kindness, that often they've only learned that they get this in relationships.
And now that you've talked about it, maybe also like a big part is probably mindset, no? Or like mindset that you, exactly what you right now said, that if there's a problem in bedroom, you like think, oh, okay, that's not a weakness. Now there's something that my body wants to tell me.
Yeah.
And I think having this kind of shift on, oh no, again, it happened again.
So
Benny, you remember?
So you learn, and there are different ways to do that via your brain, like your thoughts, more or less, or your body, right? Or the social aspect, right? Because there's, with communication with others, there are a lot of things said non-verbally and verbally, how to change them, how to change your own expectations and calm your mind, more or less, how to calm your body, right? Because lust cannot be created when we're very tense. It just doesn't work. So there are different aspects that can be influenced, and you learn from all of those aspects, which are your best aspects.
What I thought was really nice is how you formulate how you can feel for yourself if you might be addicted, like if you don't control your behavior anymore, but the behavior, like the porn is somehow...
the behavior controls you.
The behavior controls you.
So basically you cannot end these kind of things, or your morning glory, your Morgenerektion is not happening anymore, so you feel like it's missing. That can be a sign of being addicted to porn. And then that's also one of the main motivators, that when we start to work, that when they get their morning glory back, then they're like, oh my God, I thought my body was just not working.
Finally!
I'm not functioning. Many people think there is an organic reason to it, right? So they go to the doctor or something's wrong with them, and then they find out when we work that the morning glory is coming back. So what I basically do is first of all, I have to gather a lot of data, right? I need to understand, how is it for that person? What is leading? What are triggers? And many people come and say, well, I'm just bored, and then I consume porn. But the closer we look, I always find out that it's not just boredom. It's basically when there's a sense of calmness, or there's just nothing happening, then there's some feelings often coming up that are not nice, right? Work is stressful, or there's the partnership, something's going on my nerves, I'm feeling disconnected, whatever. So it's first of all trying to understand the triggers, trying to understand the exact behavior, what kind of porn is consumed. Is it actually porn, or is it online masturbation? Is it, there are different things of being addicted to, so trying to understand the behavior, and then seeing what is following afterwards. Afterwards is usually like depressive feelings, right? I don't know, I feel like I will never have a working relationship, I'm disgusted by myself, or feeling ashamed, or a lot of different things, and they're different from person to person. And then there's at some point often this, in German I would say Gleichgültigkeit, which is like, I don't care, it doesn't matter anyways, whatever, right? And then there's another feeling coming back, like this need of inspiration, a little kick or something, because something is stressful, and then the circle basically goes around. So first of all, I understand, how is it working for this specific person? how's the cycle reliving itself, basically keeping it itself alive. And then it's important for the person itself to understand it, because once they understand what is triggering their behavior, they also understand what they can do themselves to stop it. And sometimes it just needs another person in order to understand yourself fully, because if you look within yourself and you look for the solution, you don't find them that easily. As if someone like me, I ask a lot of questions, I know what to look for.
Yeah.
Right? So they understand themselves better. Then we work out mechanisms for abstinence for the first weeks. It's like I always say, now we're gonna try a period of abstinence, and usually the first 2 to 3 weeks, or the second and the third week, are usually the hardest. I always say this little pain gremlins, they jump on and they try to, draw your attention whenever you are somewhere on the street. Everything is calling for, hey, watch some porn, do this, whatever, right? You've just got to stay strong, resist. For that, I work with implementation intentions. So basically sentences like, when I have the need to consume porn, then I do this and that. When I can't do this, then I do that, right? I go out running, I go and clean the kitchen, I open my window, I call my friend, and I create backup plans. But this is not a long-term solution. This works in the short term to get the body, to get the motivation, to get the morning glory basically back. Mm-hmm. And then in the long term, we need to work, how do you cope with the actual feelings that are triggering this behavior, and how to analyze that. And then, that's basically my approach so far.
Porn somehow related to also performance issues in bed.
So that was part 1 of our deep dive with sex therapist Sarah. We've already uncovered why so many men come to therapy, the risks of porn addiction, and what erectile dysfunction can actually teach you. But this conversation is far from over, so stay tuned for part 2, where it gets even more personal and practical.